Canary Wharf, one of the most iconic skylines in the world. For some people it represents civilization, progress, aspiration, and for others it represents the physical manifestation of capitalism. Capitalism is probably best understood as an ideology, but we're often told not to bother with ideology, to leave it to the professionals and the politicians. We're often also told that we've gone beyond ideology, that politics is simply about what works and not about dogmas. So after the 1929 capitalist crisis on Wall Street, and then the oil crisis in the early 1970s, the capitalist ideology really started to come into focus, and we started to talk about the capitalist ideology in 1979. It was a year that Margaret Thatcher was elected as Prime Minister. She set about a whole series of political, cultural, social and economic reforms. She wanted to extend and advance capitalism into its neoliberal phase. Thatcher's neoliberalism would be a reversal of post-war welfare policies, and these were underpinned by three foundational principles: self-interest, markets and laissez-faire. Over there is the Bank of England. Thatcher's reforms freed traders to speculate huge sums of monies, which would eventually lead to the 2008 economic crisis. The key point here is that individualisation and individualism were taking over any ideas of solidarity and cooperation. Thatcher in 1987 told us that there's no such thing as society, only individual men and women. She made us believe in Tina, there is no alternative to neoliberalism, to the point where generations of us now know that neoliberalism doesn't work for the majority, and the rich are getting richer and the poor are getting poorer, but we're resigned to neoliberalism. We're living embodiments of neoliberalism when we don't believe there's an alternative. When Thatcher talked about markets, she wanted to commodify public services, things like transport, education and health. She wanted these things to be available for private sector companies to buy and run as they wish. Gone were post-war ideas about a caring and sharing society through a redistributive taxation system where people would be entitled things that they needed. Over there is St Thomas's Hospital. Now, if I broke my leg, the doctors and nurses would quite happily see me without knowing how rich or poor I am. And this would be paid for through a general taxation policy. Across the pond in the United States of America, if I'd broken my leg, before I could enter the hospital to see the doctors or nurses, they'd want to see evidence of the health insurance that I'd bought. Now, if you don't have any health insurance, or if you can't afford comprehensive health insurance, like 33 million Americans, then you'd be made to sign a debt agreement at the gates of the hospital. The idea is that you pay for your own healthcare, and you'd go with whichever provider you wanted to. And the providers would be trying to compete for your custom. Now, this is fine if you're wealthy, but if you're not wealthy, you're likely to be left behind in a marketised and privatised healthcare environment. Laissez-faire is a French word. It means roughly leave alone or let it be. In order for markets to expand and self-interest to dominate, Thatcher deregulated industries, allowing the private sector to take over nationalised assets. This included things like the National Railway Services. It included things like shipbuilding and steel. She claimed that the private sector would be able to provide these industries with more efficiency and cut costs. Inevitably, this has meant that workers' wages have been decreasing whilst the profit margins for the large private sector companies have been increasing. Thatcher may have deceased, but we now have a situation where global neoliberal capitalism is strident. In 2017, just 8 individuals, their combined wealth is equivalent to half the world's population, 3.5 billion people. Massive wealth and income inequality suggest that neoliberalism is not working for the many. But are there alternatives?